Hi, everyone. Welcome to the podcast on HIV/AIDS. So today is the World AIDS Day. Dr. Hina Jawaid is with us. She is the Associate Professor of Family Medicine at the Health Services Academy, and she will be talking about the situation of HIV/AIDS in Pakistan and South Asia in general. And she'll also tell us about some background information of what is HIV/AIDS and what is the current status of the disease in Pakistan. So, welcome, Dr. Hina.
Thank you very much. It's good to be back on this forum again. Yeah.
Dr. Hina, let's start with the question that I just posed. Tell us what is HIV AIDS, and is HIV and AIDS the same, or are they different terminologies for different things?
Uh, Thank you. This is a very important question because it's important for us to establish the difference between the two. HIV is human immunodeficiency virus. That's what the word stands for. And what it virus does, like any other virus, it attacks a certain group of cells in the body. Now, this virus attacks a type of cells which form the immune system, part of the immune system, and they are called CD4 cells.
Mhm,
Now, when that group of cells is affected, it weakens the immune system, and then it gets difficult for that individual to fight for any infection, say a respiratory tract infection, a kidney infection, a gut infection, any infections that we get commonly. Um, and there are ways through which this infection can be transmitted in your body, and it is very important for our population, uh, and the population I mean is in Pakistan, to know what are the different ways through which this virus can enter your body, and you need to be aware of it in order to protect yourself. So we'll talk about that in a bit, but AIDS is like a full blown disease that you can acquire at a later stage, which means it develops over a period of months and years
mhm,
from the HIV. So, put it that way, if the HIV remains undiagnosed or untreated,
mhm,
then it can lead to a number of potentially life threatening infections and illnesses that can occur in your body because your body does not have a robust immune system to fight an infection, and the immune system has been severely damaged by the HIV virus. So it happens a few years down the road, and that is why when anybody in the healthcare setting has a needle stick injury, which means if they are injured, if they injure themselves through a needle which has been used on somebody, for example, when we are in operating theaters or when we are stitching, we can accidentally do it.
mhm,
Important you get tested on the day
mhm,
and a few months later,
mhm,
just to make sure we know the baseline, like on the day one, there's no antibody or a protein against the virus already present, which means
mhm,
you were infected before. But from that day onwards, we do another set of tests a few months later to make sure that there is no seroconversion, which means previously you didn't have any proteins against the virus, but
mhm.
now your body has started to develop, which means we need to be more vigilant and do more tests and refer you to specialists and so on and so forth. So it's very important. Patient education is important. Uh, Healthcare professional education is and awareness is important. The entire staff working in the healthcare facility, from a primary level to secondary to tertiary to quaternary, whichever level you're based. Because hospital per se basically is an environment where we use equipment, where we use uh, different things like needles, drip sets, cannulas. So it's an environment which is using all these things, and they need to be sterilized, and there has to be a proper disposal system,
Mhm.
so that the others remain uninfected or unharmed because of the equipments that are being used day in and day out. Blood. For example, in blood bank, when you're getting a blood transfusion, and then there is a separate set of tests that are done on every blood that is transfused to another person, taken from another individual. And HIV testing is one of the tests that is routinely conducted before we can um, infuse or transfuse the donated blood to another individual. Yeah.
Okay, that's really insightful. So HIV is a virus,
Yeah.
and AIDS is a full-blown condition
Yeah.
that results from HIV. And a person who is infected with HIV, it takes a while before the person gets AIDS. And you said that if there is so we'll come to the treatment when we're talking about it. But so so the thing is, HIV is a virus and it results in AIDS after sometimes. So thank you for that. Dr. Hina, can you tell us about what is the status of HIV AIDS in Pakistan currently?
Okay. When I was preparing this session, I was looking through various data, and it's the information that is available, and I can share the reference of it as well, is the incidence is rising in Pakistan.
Mm-hmm.
And currently, I just check, it's 1,83,705 people living with HIV in Pakistan at the moment. So
Mm-hmm.
that's the incidence at present. And one of the things I would like to point out are, I know we will be discussing the different risk factors for acquiring
Mm-hmm.
HIV, and we've talked about some already. But there is a vulnerable population, a high risk population that is already there.
Mm-hmm.
So that needs to be included, targeted, talked about. And by we, I mean healthcare professionals need to be aware of them. Going back to the use of needles, so there's a certain group of people who use needles as part of a habit or a behavior, which means they are IV drug users. So it's very important, like from primary care professional, physician point of view, when we are taking history, we need to identify some these individuals because these are vulnerable, at risk, or high risk. One thing I would like to mention here that our job is not to judge anybody. Our job is to act in their best interest, and that is why we are needing that information so we can help them as much as possible. By help, I mean rehabilitation or provide them with clean needles. Yeah.
Mm-hmm.
And then there's another group of people which are called transgenders or MSM, men having sex with men. They are again high risk.
Mm-hmm.
These are sensitive information, and it's very important for us to have that information.
Mm-hmm.
Um, and whenever you are documenting it, make sure you ensure patient confidentiality. The reason why we need it as part of the notes is so we can refer them to our colleagues who are specialists, who the patient may need later for
Mm-hmm.
help. Um, then people like barbers. Um,
Mm-hmm.
it's very common in our community that there is a single barber who is serving a population of few hundreds or thousand, depending on the area. And he uses the same shaving kits, the, um, the knives and through equipment which contain blades
Mm-hmm.
um, to shave a number of individuals. So again, that bit of education is important. And then vertical transmission from mother to child. So that's where the antenatal care comes in. You need to identify. And people who are needing, like the recent outbreak, I know we'll talk about that later in Nishtar Hospital, where patients on dialysis, those who had kidney problems, they acquired it. There have been almost 4 outbreaks so far, but we'll talk about them later. Yeah.
So, thank you very much, Dr. Hina. We have already touched upon some factors which contribute to spread of HIV in Pakistan.
Mhm.
Are there any other factors beside the ones that you already spoke about, or should we move on to our questions about the role of health practitioners?
I think it will cover the role of health practitioners to some extent in the description, but I think it's important to talk about or be aware of the different outbreaks that have happened. And one thing that has been consistent in most of them, three of them almost, is the use or reuse of a used needle,
Okay.
syringe, or a drip set. So, and that raises a question that why it keeps happening again and again. So, the first incident was back in 2008, was Jalalpur Jettan in Punjab, where 88 HIV patients were diagnosed, were found out, and
Mm-hmm.
it happened through reuse of a needle.
Mm-hmm.
So, to be honest, there is no way to identify that the needle has been reused until actually it goes in your body where it, because it has lost that sharpness because it has been used multiple times. And then when it goes in your body, it feels very painful. But then it's too late because it's already kind of breached the skin and gone maybe deeper. But the fact is there, they have been reused. About 10 years later, in 2018, in Kot Imrana and Sargodha, there were about 700 HIV patients. Again, when things were investigated, reuse of needle was found to be the cause. Now, mind you, this is a preventable cause.
Mm-hmm.
We could have prevented this.
Yeah.
There's published data. I mean, if anybody wants to kind of search it, the evidence is available. It's been published. In 2019, a year later, in Rattodero Larkana, about
Mm-hmm.
800 patients, out
Oh.
of which 139 were adults and 646 were children. So a good 82% were children under the age of 15 or around the age of 15 who were, and again, it was the same cause. Um, Needles were reused rather than
Mm-hmm.
they were discarded. So again, over the years, we have seen there is escalation in the number of people that have been affected, and we've got a larger percentage of children who are HIV, who haven't developed the AIDS yet, but as they live longer, there is a risk if they've not been treated appropriately. And in 2024, we have recently heard about the Nishtar Hospital dialysis patients. So um, it's something that really needs to kind of wake us up and question why this is happening, and there's no stopping to it. Every few years, we see an outbreak of HIV. So the question arises why it's happening. Um, and while we are talking about it, I want to mention the number of injections that are used per person per year in Pakistan.
Mm-hmm.
Um, and it's again evidence-based. There is data out there. There are references. Pakistanis received the highest number of injections per person per year in the world.
Mm-hmm.
Uh, so it's 8.5 injections on an average that
Okay.
each individual gets every year. And if you compare it with the numbers with your neighboring countries, our figures are significantly high. And out of these injections, 94% injections are unnecessary and can be avoided. Now, 94% is a big figure again.
Yeah.
And we would question why it's happening, why there is a trend or of so much affection with injections,
Mm.
and why is it being promoted, or why is it so liked or one of the favorite options. So you have to look at both sides, the provider and the patient.
Yeah.
And I think the education has to be on both sides. Uh,
Mm-hmm.
I know there have been attempts where physicians have tried that injection is not the treatment for every condition,
Yeah.
which is fine, but the education needs to be continued. And the only cadre that can provide a continuous education is a very is a robust and organized primary care system in the country, which consists of a qualified trained general practitioner or family physician, along with his or her entire team, which includes our nursing staff, advanced nursing practitioners, lady health workers, and so on and so forth. All those people who are actively engaged in the community. So the word needs to go out on a regular basis, um, almost every after few days, weeks, or months, depending on the burden of disease in that area or the extent to which the injection is being used. So having 94% injections, which are unnecessary, if we can prevent just one aspect, I'm sure that the risk will fall down significantly. So yeah.
So, two things, two questions, short questions. So, one, you were saying that the reusable people, the healthcare providers are reusing syringes. So,
Hmm.
don't we have disposable syringes in Pakistan?
Well, ideally, if a syringe has been used, it should be discarded appropriately.
Yeah.
We have yellow bins available,
Mm-hmm.
which you throw the injection or the needle or the sharps in the sharps box. And at places there are needle cutters. Now, with needle cutters, it's usually advised to not cut the needle, because then when you cut it, there is a bit of a spray, and that content in the needle, which is mostly blood or any other thing, can affect other individuals standing nearby. But again, the availability is an issue. Are there ways where we are destroying the entire needle syringe together and it's being picked up and reused? Maybe there is a mechanism. I'm just trying to think out aloud here, finding the causes. Then there's a um, needle called auto-disable syringes, in
Mm-hmm.
which once the needle has gone in, it goes back into the plunger, the needle. So neither the needle or the syringe can be reused again.
Okay.
Are used currently in a number of facilities, particularly when you're vaccinating children.
Mm-hmm.
So they are used there, and they are used in certain other setups, private sectors. It depends on the healthcare facility. But what I was hoping was to see more of it
Okay.
being used across the country, considering the number of outbreaks we had. So, but that hasn't happened. So we need to
Yeah.
find out the reasons why it has happened. Is there no manufacturing facility within the country? Is there any way we can like import it from other countries or something like that? It needs to be looked at. Yeah.
Thank you, Dr. Hina. The other question was, so you mentioned that 8 injections per person. So does this include children also, or these are adult only numbers?
In quote Imrana, uh, the figures included children, and a good significant number were children. About 80% were children.
No, no.
Around.
Sorry, Dr. Hina. The injections that you said that there are about 8 injections per person in Pakistan that are unnecessarily given
Yeah.
to people. So
Hmm.
is that number include the children or the adults
Uh,
only?
no, that's the adults figure.
Okay.
That's the adults.
And you would think that in children more injections are used, right?
Um, I don't have the exact figure
Mm-hmm.
on that. Um, yeah, it says, I've got some of the details here. Injections are overused in Pakistan, as we said. So
Yeah.
approximately 1.5 billion injections are used annually in Pakistan,
Yeah.
of which 75 million is used for immunization. So you
Yeah.
can justify that. That's for
Okay.
children, and yeah.
Yeah.
While the larger remaining portion is used as part of the treatment. So, on an average, 8.3 injection is used by one adult person in a year.
Okay.
And 93% of these therapeutic injections are unnecessary.
Right.
Moreover, the same syringe is used multiple times on multiple patients. And this is associated with increase not only of the risk of HIV, but hepatitis B and C. So that again puts us in a difficult position. Yeah.
Thank you, Dr. Hina. Okay, now tell me, how can general practitioner play a role in HIV prevention and management? How can we play a role?
Okay. Well, there are multiple things they can do. They need to be aware of the HIV and the AIDS, the
Mhm.
disease, because remember, those who acquire HIV not necessarily will develop and AIDS.
Okay.
Uh, so prevention again is the main area. They have to have a good quality education, which they can obtain through courses, and there are a number of courses taking place by renowned people who are authentic and uh, and they are experts in the field of infectious diseases. So be mindful, be aware of, be part of those networks or social media forums where you can obtain up-to-date information. So that is important. Educating your patients, even if you have to tell a number of times in a day, oh, injection is not necessary and it's not needed. If you can take the medicine by mouth,
Mm-hmm.
best to avoid the, because most of the time it's a painkiller we need. But
Yeah.
that's where I use the word training and qualification, because if as a general practitioner you can extract the information out appropriately, you will be in a position where you can identify the severity of the condition and whether it requires a medication that can be given by mouth or it can be given through an injectable. So if your analysis is, oh, we can treat it by a tablet which is given by mouth, it is much safer than to. I know patient demand is there, patient expectation is there, but at the end of the day, you are the one who is responsible to act in patient's best interest. And if you think you can give the patient option. Obviously, there are challenges where we have to kind of admit to what the patient requires, but as long as patient is making an aware, informed decision, then the autonomy has to be considered, obviously. But it is some once you spend that time education, educating a patient, the next time that same patient comes in, it will be easier for you to have that conversation. And this has to happen across at every level in primary care, not in just one part of the country and not happening in the other part. So it's something. So that's one thing. And as I said, identifying high risk individuals, be in connection with the specialist so that you are able to report any activity, or if you have identified, if you have suspected a condition, you are able to kind of get the others on board and try and assist that patient in getting the required treatment or rehabilitation, particularly if it's a drug user and thing. So we work with multiple teams. We don't work in isolation. Patients who are on the medications, you need to be aware of their treatment plans and if there are any regular bloods they need doing, particularly CD4 count. If patient is experiencing any side effect of the medications or has any reservations about the medications, then you should be in a position to answer and respond. So you have to be in connection with the specialist. It is a condition which I don't think anyone can treat individually. And depending on the socio-economic or the nutritional status of the individual, you have to kind of look at all those areas basically. Same as tuberculosis. So it's a chronic disease. Yeah.
I think quite challenging.
Mm.
So uh, I think one of the another thing which is important is that we have a lot of quacks in Pakistan. So even if
Yeah.
you train general practitioners, the people who are acting as quack, and I think those are the people who are mostly um, giving injections compared to
Mhm.
the doctors. Um, so so that's one of the challenges that we face in Pakistan. So can you give me some other challenges that are faced by health providers in managing HIV/AIDS in Pakistan?
Okay. I think the regulatory authorities, the health regulatory authorities, we need to bring them into this in this circle as well. Um, it, the policies and laws have to be implemented, right? And if there are any barriers to their implementation, then they must be identified and acted upon.
Mhm.
Uh, I mean, I've given you evidence since 2008, and we are in 2024, and we are still experiencing the outbreak. So one question keep arising: what have we learned from the previous one? And what measures have we taken to avoid a similar incident to happen again?
Yeah.
The answer that's coming back is we haven't learned anything, and that's why this is a re-emerging thing. Those sitting in positions of responsibility, I think they have to be accountable um, for what the responsibility holds with them. in terms of the area they cover, particularly the areas where the outbreaks have happened. I think responsibility lies with all of us, basically. But
Mhm.
I think, as I mentioned, auto disabled syringes is one of them, which
Yeah.
self breaks and auto lock syringes to minimize the reuse. If it hasn't been implemented across the board nationally, because there have been conditions where national task force was developed for various health related problems, and injection safety was one of them. So if there were any reforms that had taken place, why there was lack of implementation and stuff. So I think learning from past is experience, and up until now, very few measures have been adopted, and I think providing quality, health, safety, health-related matters are part of our constitution, are part of our policies already written there. So I would go back to the same thing, the question of lack of implementation and what needs to be done and why it hasn't been done. Um, so in order to make an action plan successful, it is important that it's implemented at multiple levels. So what are the level of barriers or the layers of barriers there are? They need to be addressed. Yeah.
Thank you, Dr. Hina. Okay, now tell me what happened in Pakistan in this recent past where there was an outbreak in a major hospital. Can you give us an idea of what happened and then what is the status now?
Um, I mean, the information that you get is mainly through print media and through the social media platforms. Um, I've heard things like Pakistan Medical Association has held a meeting and they've kind of voiced their concerns about the blame shifted towards doctors and the vice chancellors and stuff. But and then there was another group there was another institution that was investigating the issue, and it kind of arrested a few people, and then there was an issue why that institution didn't have the jurisdiction to do it, to carry out the investigation. And so
Mhm.
it means like it's all quite kind of haphazard. We are not getting concrete answers. It looks like people are shifting the blame from one group to another group. And that raises a question. Well, is the job description of who has to do what not clearly defined, identified? Whose role was it to ensure the cleanliness or of that unit, the dialysis unit, where a number of patients were coming, and why something was not reported? Because, as part of clinical governance, we do things like clinical audit. I understand they're not regularly done, but that is where the problem is. Incident reporting is important. And every time there is a needle stick injury, for example, it is reported. And the purpose is not to penalize anybody, but purpose is to learn from that mistake and avoid that thing to happen again to another individual. And what are the safety measures in place? That would be the question. These are the things we should be addressing rather than blaming an individual and kind of start arguments and stuff, which are not going to lead us anywhere. But
Mm.
so I don't have a concrete answer. I don't have a definitive answer. I'm still waiting for it, but I don't know how long it will take before we get to it. Yeah.
Okay. So I think the important thing here for me would be what is it for the people who got infected. So those people who were using that dialysis machine, what do you think um, would be now? I mean, they would be extremely stressed. I know, I mean, people who went there, it's going to be extremely stressful for them, for their families, for people around them. And we know that there is a certain stigma and people are not very well educated about what HIV/AIDS is. And so that those all things to one side, that these people not only need counseling for what they went through, but also their mental health is also quite at stake. But just tell me what is it for that patient? Just hypothetically, just one patient, one woman who is maybe in her um, 35, 40-year old and maybe going for dialysis. What what do you think would happen to her as the events in future?
Well, I
It's
think
just a hypothetical scenario, just trying to understand what would happen to such patients.
I think the one thing that is needed in our society is empathy.
Hmm.
Uh, Empathy, because that connects us with individuals, with humanity, basically.
Yeah,
And I think it has to be obviously those who have now acquired the condition and it's not their fault, particularly if somebody has used a reused needle and used it on multiple patients and now given that individual an HIV, which is not his or her fault at all. So, as I said earlier, our position is not to judge anybody.
yeah,
Our position is to help them, and that kind of thought process need to be taught. If it has to be taught, it has to be taught at school level, at colleges level, and higher level, at workplaces, at universities, in healthcare facilities. We are not here to shun an individual. We are here to assist them. They equally have the right to live
yeah,
and live in the best possible way. They have to be the productive part of the society. Mental health illnesses, yes, because there, you remember, there is a resentment in that individual. Oh, I got the disease through somebody who may have done it deliberately, and uh, that thing kicks in, and he or she now may want to give it to somebody else. So are we creating that environment where that resentment is getting into an aggressive form, and that individual wants to take the revenge from the rest of the society? So we need to stay away from these things. Basically, these things need to be contained, um, because let's be honest, somebody somewhere failed. As a result, our population was exposed to it.
yeah,
And that's why I said empathy needs to kick in a bit quickly than we realize, because we cannot take anybody's right to live.
yeah.
And we can talk about it in broader aspects, but this is what the crux of the matter is, basically.
So
Yeah.
generally, do you think that these patients, once, I mean, they've been infected, and then you said that they'll be going through some investigations in
Yeah.
future, the CD4 count, and all that, to see whether they have what is the level of antibodies in there. Um, so, do they come to general practitioners then?
Um,
Because I'm trying to understand the role of general practitioners here, because you said in the beginning that these will go to specialists, and because general practitioners are not specialists, so that's why I'm trying to ascertain what's the role of general practitioner for such patients.
okay, so those who have been diagnosed and are under treatment, see, the background education about the disease carries on, like with any chronic disease. And I'll give you an example. Somebody had a heart attack. We don't kind of treat them. We do treat them partially, but not like fully, but they do come back to us.
Yeah,
So, depending on the age group that they are, say somebody who's single and now wants to get married, he's somebody with HIV, he's somebody who has had their treatment done and the CD4 count is fine and is perfectly aware. And so, what safe sex practices we can teach them, how they can keep themselves healthy away from other conditions. What if they are going abroad? What if they are undergoing a dental procedure or any operation? What they need to do, they need to make others aware, right? And then extra precautions are taken by individuals who are treating them. Because this thing has to be spoken about to a number of people, including those who you will be developing relationships with, it's important to kind of break that barrier of the stigma, as you said, attached to it. How we are going to do it, how we are going to kind of give confidence to these people is more awareness, more education, more talking about it. Um, we see other cases like, as I said, vertical transmission, but then there are cases of sexual assault and rape.
mm,
And are we kind of identifying or kind of closely following up these individuals for communicable diseases? That's another question.
mm,
So the number of questions arising are a lot, but the question is, what are we doing about them?
Yeah.
Denying, denialism, not looking at the actual problem is not going to serve the purpose. Let's be very honest here. Dealing with it, talking about it, finding ways to assist these people. Um, because a lot of questions do come to us. Are we, as general practitioners, prepared to answer all those questions? If not, then we need to kind of equip ourselves to be in a position to do so. So it's not a one-way stream. It's bilateral. It's as
Mm.
much our responsibility as anybody else's, basically.
Yeah. So what are some initiatives that are currently in place in Pakistan which combat HIV/AIDS?
Okay. Um, Initiatives are okay. Some larger institutions have developed their satellite clinics.
Okay.
Some of them are functioning well, but again, it's the check and balance, the monitoring, making sure the practices are standardized. What we see with those clinics are the medication side of things is fine, but the non-pharmacological approach, patient counseling, prevention, behavior change, rehabilitation,
Mhm.
discussion of such issues openly
Yeah.
is lacking. And I understand specialist clinics cannot do everything because
Hmm.
the number of specialists we have is limited. And that is where the role of primary care comes in. So
Yeah.
the non-pharmacological approaches, the prevention side of thing, telling patients you do not need an injection for every condition, is important. And I'll
Yeah.
give you an example. We have a trend in a number of places in Pakistan where our females, they are feeling weak, tired, lack of energy. They go for a drip which contains multivitamins.
Yeah.
Now, yes, it's a quick fix. They get better, they work for a few months, and then they come back after a few months and get another energy drip. That is a behavior change that needs to be addressed. They have to be told that the value of healthy eating, nutrition, use of oral supplements. There are
Yeah.
supplements available and in affordable prices. So
Mm.
is the patient not aware of the tablet form? Is the patient not affording? What's stopping them from using the oral tablet? So
Mm.
this is where the primary care comes in, and education, long term patient education carries on. It's never like, even with things like diabetes, on the day one, when you told the patient these are the foods you need to stay away, on day 50 or 2 years down the line, you say the same thing. So
Mm.
the education keeps, we do need reminders in life, basically. So that's
Yeah.
what, yeah.
Yeah, no, no, you're right. I mean, thank you for elaborating a bit further on what general practitioners can do. And there is also National AIDS Control Program that's there in Pakistan, and you were mentioning that there are various initiatives that are led by them or organizations related to them. Dr. Hina, you just mentioned about the sexual link to sexual transmitted link to HIV, but in your earlier talk, since up until now, you were mostly talking about injectables and transmission of HIV through injectables. I just want to understand, is in Pakistan, injectables are the primary source, or as a sexual transmission is also equally important source. Um, and I'm talking about, I mean, we did mention about men having sex with men and transgenders, but about transmission from husband to wife or partners, or from mother to child. How is that factor also something that we have in Pakistan, or are
Mhm.
our transmission mostly um, through injectables?
Okay, that's a good question. In the published data, there were figures mentioned about vertical transmission from partner to another partner, barbers, and other occupation-related conditions or needle stick injuries, healthcare workers. The highest percentage came for the reuse of needles.
Yeah.
Um, so the figures, according to that paper, the highest were of the reused needles. Um, so I don't know if our data about other conditions are lacking, or there is a limited studies available.
Mhm.
Surely we need to look into that. But according to two papers that I went through, and that is why I said it's a preventable. This is something which you
Yeah.
can easily prevent. There are other conditions which may be a bit challenging to prevent, but reuse of needle is something that can easily be dealt with, if we really think about doing it. So yeah, so transmission can happen through contact with the body secretions, the fluid. So it can happen from one individual to another, intimate partners, vertical transmission, IV drug abuse, or simple blood transfusion itself, which hasn't, the blood hasn't been checked. Um, and the reuse of needles is one of them. But yeah, a lot of people think, oh, this person may have has got a high risk lifestyle or a behavior that led to it. But the study shows the percentages of people getting NHIV is other way around.
Yeah.
So no
I mean,
such.
I think it could be the type of society Pakistan is, where it's people are more likely to have injectables compared to having
Yeah.
illicit sexual relationship. Okay, thank you, Dr. Hina. My last question is, what future do you see for HIV/AIDS management in Pakistan?
I think now with the advances in the treatment, people with HIV can lead a normal life. It's and the life expectancy is good as well. It's just the information flowing to those individuals. In this day and age, an individual who's not aware of where to go, the navigation system is lacking, is something that is not acceptable. Because look, there is a solution to every problem. And what our job as people who are sitting in positions of responsibility, who are teaching and training the doctors, who are part of policy making and administration and clinicians, is we go out and reach to as many people as we can through various forums. Um, and a snowballing, use the snowballing effect. It can be a bit slow, but it will eventually lead us there. What we don't want is people not having the information. They suffer in silence, and they think there is, oh, all doors are closed. There's nothing. There's no hope for me. So I think the awareness needs to go to, and I'm sure there are a lot of institutions that have got the data of the hotspots, the areas where we have to target these activities more. So we need to utilize them. And I think the one thing that I keep saying in every talk, in every presentation, is ask the question, because general practitioner is a patient advocate. The other
Mhm.
day we were talking about a lack of availability of one form of contraception. And I said, if every general practitioner talks about it, then the availability will no longer be in question. It will be available. The voice needs to be raised about why an option which is much safer is not available and another option is. So it's a collective responsibility, as I said. Yeah.
Thank you, Dr. Hina. What about the role of government? I mean, we did talk about specialists, general practitioner, people. Um, but what do you think is the role of government on here?
Okay, in our part of the world, let's admit the governments change over sometimes a short period of time as well. But those things that are part of the legislation, they are part of the law, um, they continue, right? So my question would be, regardless of what happens, the system needs to continue. the the implementation needs to take place. If some work has been initiated by, regardless of who has done it, but it's working, you're getting good results and outcome, that needs to be continued, that needs to be acknowledged and continued. So and that is where I said patient advocacy, awareness, people speaking up, showing their concerns is that matters. the public needs empowerment about various things so they can speak up and say, oh, this could have been done, why it wasn't done, and why this option not available. Yeah.
So this means that the legislation is there, but it's the issue of implementation, consistent implementation, that is a
Yeah.
problem in Pakistan.
Yeah. Yeah.
Okay, just one final question.
Yeah.
The treatment.
Yeah.
So where do people get treatment from? And is there treatment available with general practitioners, or do patient have to go to the specialist?
Okay, so the antiretroviral treatment or ART therapies are available with the infectious diseases consultants, teams, clinics. They can be given in the antenatal period, but obviously they need close monitoring. So the treatments are there.
Mhm.
Yes, as GPs, we can signpost them to these specialized clinics depending on the patient. As I said, if it's an antenatal period, a lady coming with pregnancy, then obviously obstetricians and gynecologists they get involved as well, and the pediatricians towards the later stage. But infectious diseases consultants are the mainstay of treatment,
Mhm.
and I would keep them in the loop. And luckily, Pakistan has got a very good team of ID physicians. Uh,
Mhm.
and they'll be more than happy and willing to guide. And a lot of them are actually going out, reaching out to a lot of us, even if they are based abroad, to conduct courses
Mhm.
and engaging as many people as they can, including primary care physicians. So yeah, I think it has to be a collective voice. So if general practitioners have got any concerns, they are not sure about something, I always encourage them to ask, regardless of how trivial the question is. If you don't know, you don't know. You pick up the phone, ask them, message them, bring up that concern and talk about it. Yeah.
Thank you, Dr. Hina. So do you think that is there anything that we left we didn't discuss? If there is, just please.
I think we've covered a lot of ground here. We've covered the incidents, the risk factors. We've talked about various studies, and the responsibility of individuals, be they are in the medical profession or any policy making administrative profession. So, if I just want to give one message through this presentation, this session would be. If your doctor is saying you don't need an injection, take their word. But if you have any concerns, just ask about it, because is having that infection putting you at a higher risk? And always check, always check. I know most of the patients pay for their treatment. Always check and ensure that the needle that is you're getting is coming freshly out of the pack and it wasn't just lying anywhere. Ask. Even the patients have to ask. There's no point putting your life at risk. Yeah.
Thank you very much, and that's a very important message, I think, and that is one takeaway that I would also take from this podcast. That ensure that the syringe is safe. Thank you, Dr. Hina. It was a very important talk because it's the World AIDS Day today, and we will meet again in a week time. Thank you very much for your talk. Thanks a lot.
You're welcome. Bye.
Bye.